Okay, so now let's look at all the features that we can see from this, from the articulated skull. Articulated meaning all the bones are articulated together. And so we'll start here with the frontal bone, and we'll just work the face, go to a lateral view, right? And then we'll look at an inferior and superior view looking inside the skull. So on our frontal bone, this little area right here where you get your little frown lines would be the glabella. Then you can see we have these kind of superciliary arches. And then there is the supraorbital foramen. So supra above, orbital because this is the eye orbit. So supraorbital foramen. Okay. And we do have, these will be things that are on both the right and the left. All right. Then below the orbit on this maxilla, we have the infraorbital foramen. Okay. Don't forget we have our two nasal bones here. Remember our lacrimal bones are missing on this one. So let's look real quick at the nice newer skull. And there we have our lacrimal bone. And this little passageway right through here, that's that nasolacrimal groove. Okay. Now let's look at our zygomatic bone. The zygomatic bone has three major processes. This one up here, this right here, and this one that comes out over here. So the processes are named for the bones they articulate with. This process here articulates with the frontal bone. So this would be the frontal process of the zygomatic bone. This process right here, it's kind of thin and angled, that articulates with the maxilla bone. So this is the maxillary process. This process here articulates with the temporal bone. And so this is the temporal process of the zygomatic bone. While we're talking about processes, this temporal bone has a process that articulates with the zygomatic bone's process. So this is the zygomatic process of the temporal bone, and this is the temporal process of the zygomatic bone. Combined, these two form what's called the zygomatic arch. So if I've got an arrow pointing here, or I have an arrow pointing here, I'm asking about the process of the bone. And if I've got something sticking over where you can't see the suture, and it's like identify this structure, then it would be the zygomatic arch. Okay. So on the maxilla and mandible, we have these alveolar processes right here. They're for basically where we have each tooth. Okay, those are the alveolar processes. Down here on the mandible, okay, right here, the mental foramen. Remember we learned that the chin, that region was called mental, so mental foramen. And then here, right, so this is all the body of the mandible. And then we have this ramus, and we have two processes off of here. We have the coronoid process, and we have the condylar process. Okay, and I'll show you this on the whole mandible that's disarticulated from the skull. But up at the top of this condylar process, you have what's called the head of the mandible, also known as the mandibular condyle. Okay, so this would be the ramus. This is a process. This is a process. If I'm at the top, then I mean the mandibular condyle or the head of the mandible. All right. Now, if we continue to go back here to this temporal bone, in addition to that zygomatic process that helps make up the zygomatic arch, you also have your external acoustic meatus, and then here you have what's called the mastoid process. Okay. Now, another feature is the mandibular fossa, and that's where this head of the mandible, aka the mandibular condyle, sits. And so I'll show you that on the individual temporal bone later. And any other features that are from inside or underneath, I'll talk about when we look at those views. Back here we have our occipital bone. For the occipital bone, we've got to know this opening here, and that is going to be the the foramen magnum. And then these two kind of smooth areas right here and here are the occipital condyles. Those are what will articulate with the first vertebra, which is the atlas. Okay. Just inside of this foramen magnum is another opening on both sides here called the hypoglossal canal. And I'll show you that again in a little bit. Now, from an inferior view, you can see this foramen magnum. You can see the occipital condyles. Oops. You can see this opening right here, this nice big circular opening on the temporal bone called the carotid canal. Sorry, my phone is shaking a little bit here as I go through this. And then we have what's called the styloid process, but it's broken on this particular skull. So I'm going to move this one off to the side and show you the styloid process on this one. So this long piece right here on the temporal bone, that's the styloid process. So if that's the mastoid process, that's the styloid process. And again, there is that carotid canal, that passageway right there. Okay, now I've turned this around so we can look at what we have up here. So if this is our maxilla, from down here we can see right here and right here the palatine processes. These palatine processes meet up with the palatine bones. And we have a few passageways to look at. You've got this one right here that's formed from the two maxilla bones articulated together. And where I have the little stick is the incisive foramen. And then there are some little holes right here on the palatine bones. Those are called the palatine foramina. Well, a singular would be foramen, but there's multiple ones. So I sometimes just say palatine foramina. Okay. One other feature here on the mandible, this here, right, the mandibular foramen, another little passageway. So that is everything I wanted to point out from the inferior view. But before we go inside, let's talk about our sutures. Okay, so here we have the frontal bone, and this suture, or this articulation, right, it's called a suture, and it has a name. This is our coronal suture between the frontal bone and the two parietal bones. The suture that runs between the two parietal bones, that's going to be the sagittal suture. Our suture that runs between the temporal bone and the parietal bone, this is going to be the squamous suture. And then this suture that runs between the parietal bones and the occipital bone, this is our lambdoid suture. Okay. Make sure when we're looking at the individual parietal bones that you can tell the difference between right and left when they're not on the skull. Okay, so let's look inside here. So we don't see much of the ethmoid. A lot of the ethmoid bone has kind of disappeared right here. But our ethmoid sits here, and there's this little kind of pointy structure up here, and that's called the crista galli. And then the plate below it is called the cribriform plate, and the holes are called the cribriform foramina. We come down here, and all of this is sphenoid right here. So this is the optic canal, and I'll show you the optic canal from the front in just a little bit. Right here and here, you have your optic groove that forms along here. This little depression right here, this is called the sella turcica. If we look over here, we have 3 holes. Now, there are some other holes in here, but we've got the foramen rotundum, then we have the foramen ovale, and then we have the foramen spinosum. Now, this bone is old, so you're going to see all these other little openings, but we have 3 right here, the foramen rotundum, the foramen ovale, and the foramen spinosum. And then this gash right here in the bone is called the foramen lacerum. So again, let's get that. Foramen rotundum is right there, foramen ovale, foramen spinosum, and foramen lacerum. Okay, over here, we see the internal acoustic meatus, the jugular foramen, and then your magnum, or your foramen magnum. Now, there's also, just inside of that foramen magnum, that little hole, and that one was called the hypoglossal canal. Okay, so let's take a look real quick at the inside of this kind of newer, nice skull. And we can better see that cribriform plate with the little holes in the cribriform foramina on this ethmoid bone. There is that little crista galli, the little kind of pointy sail poking up off of it. Here we have our optic groove. The optic canals come from here. I'm going to show you a frontal view in just a moment. And then this big depression right here where the pituitary gland sits is the sella turcica. Then we have the foramen rotundum, foramen ovale, foramen spinosum, and the foramen lacerum right here. All right, so you don't have all those extra deteriorated bone spots that look like other holes. Okay, and so that is the inside view. And now let's try and see if we can see the difference between the stuff inside the orbit. So right here, there's a hole. Oops, right here, there's a hole. And where that hole goes through to the inside, that's the optic canal. Okay, so that's that nice little hole that forms right there. And then this gash looking thing, that's the superior orbital fissure. And then there's another little gash on the bottom, and that's the inferior orbital fissure. Okay, so I think that's it. All right, and that will end this video.